Hi, my name is Dr. Melody Covington. I am the CEO and Medical Director of Abundant Health and Vitality Associates in Charlotte, North Carolina, where we provide personal weight management for our patients. And we try to personalize those plans so that we are able to provide specifically what each patient needs for their weight loss journey. I'm here today with Miss Harper, who is one of my favorite patients, and we're going to have a talk about her experience with bariatric surgery, regaining weight after bariatric surgery, and re-losing it again after bariatric surgery. So we're going to have a conversation about, a little bit about her history with weight gain, and how she is being successful right now with her continued weight loss. So, hi there, Miss Harper. How are you?
I'm doing well, Dr. Covington. How are you?
I'm awesome. So, let's start with this. Tell me a little bit about your weight journey in terms of gaining weight. What was that like?
You mean after surgery or just initially?
Initially, yes,
Initially,
where we started. Were you heavy as a kid?
I was heavy as a kid. I would say about third grade is when I really started to gain weight, and it just every year I continued to gain weight up until the time of high school. I think by the time I got out of high school, I was 250 pounds at that time. And and I went out into the world. I went to school. I went out into the world, and I continued to gain weight till I think my all-time high, I had gotten up in the 80s, the mid 80s. It was like 291 pounds at that time. And that was my all-time high. And that was during the time when Oprah was doing that OptiFast.
Mm-hmm.
And I was like, oh my God, I want to do that. I believe I can do it. I'll be successful. I'll never forget when she rolled out that thing of that fat. And I saw that. I was like, I think I can do that. And some of the people in my church was so kind that they helped pull together and help me to do that. And at that time, I think I lost about 70 pounds.
Wow.
During that time, I was really committed, and it was so stringent and it was very strict process. But I was determined that I wanted to lose the weight. And I think at that time I'd gotten down to like 230 something at that time. And I did pretty well. I hadn't incorporated exercise at that time. And you know how things are, you get off track and you don't follow through, you don't incorporate good habits. And I think one of the things throughout this whole process is what I've learned, that I don't like to use the term diet anymore, because diet is just that, it's a diet. And it sounds like something that is temporary, and that's how people see a diet, as temporary. So now I like to say lifestyle, that I take on a lifestyle as opposed to using the term diet. But anyway, I continue to gain weight, and I'm going to fast forward to like into the 2000s. I probably at that time was in my 300s, and just continued to get heavier and heavier. And I want to say 2005 it was. I had a pain in my left hip and was afraid to go see about it, because I was afraid what had been told to me. And I remember I decided that I was going to go to find out what the pain was. And I saw an orthopedic, and I will never forget the day that I saw him, and we talked about my hip, and he was saying to me it was because of my weight. And at that time I was clearly probably about 350 at that time. I had such a hard time getting on the exam table. And I remember him offering to me, he said, well, have you ever heard of gastric surgery? And I could remember when he said it to me, I felt offended. And my response to him was, well, yes. And I was really kind of doing my head like that. And I was like, yeah, I do know what gastric surgery is. However, it's too drastic of a measure for me. I know several people that have done it. I mean, that's exactly how I spoke to him. And he said, and he just looked at me, and he motioned to his nurse to go get the papers. And I was thinking, I know this man just heard what I said. I wasn't interested. But he proceeded to bring the papers, have her bring the papers. I took the papers. And I thought, well, when I get downstairs, I'll just throw them away. But for some reason, I did not throw the papers away. And I think this was towards the end of 2005. In 2006, I started the process of my weight loss journey, checking into it and finding out what I needed to do. And at the time that I went through the process, it wasn't quite as stringent as it is now. You know, now you have to lose a certain amount of weight. These insurance companies are requiring that you do that. I did find a nutritionist. I went through the process. But one thing that I remember in particular, just before I was getting ready to go through the process, I worked for a dermatologist practice and I was having my yearly skin exam. And I remember after the doctor examined me and I had a robe on and they left out of the room and there was a big mirror behind the door. And I remember standing up looking in that mirror, and for the first time, I felt like I saw what I thought people saw when they looked at me. And I remember I just burst into tears to think that, oh my God, this is how people see me. But the one thing that was a consolation to me is that I knew that I was in the process of getting ready for that to change. And I was excited and couldn't wait for that to change. Fast forwarding on to 2007, July 2nd is when I actually had my gastric surgery, which was probably one of the happiest days of my life. I had the surgery, was excited, and probably 3 weeks after I had the surgery, I had a major complication. I had a bowel obstruction, a very serious bowel obstruction that I had to have removed. And after that, I had, several complications, but nonetheless, I was still losing weight. And I was really excited. I felt like that my personal journey happened so that I could help somebody else. And I would say, honestly, for about 10 years, Dr. Covington, I did exceptionally well. And generally, the honeymoon period is 5 years generally. But for me, I got double, I guess, for my trouble, if you will. For the complication, I felt like I got rewarded in some kind of way where the surgery helped me for 10 years. And when I started to regain weight, I can remember the first 5 pounds I gained. I freaked out about 5 pounds. And I remember going to my doctor. I said, oh my God, I gained, I gained 5 pounds. I was in a panic. And she was looking at me like, that's not such a big deal, But for me, it was a really big deal because to gain 5 pounds when you haven't gained any weight at all is a big deal. And I noticed that I continued to gain weight. And I couldn't figure out why I was gaining weight. Nothing changed. Nothing was different than what I had been doing the last 10 years. And finally, I came to the conclusions. One of my friends shared with me. She said, well, Velda, I think you may be in menopause. And I can remember I felt like a deer caught in headlights. I had no idea. I just had no idea. And I was like, oh my goodness. So then I started doing some research only to find out that's what was going on in my life. And I think too, Dr. Covington, honestly, to be truthful, I was in denial. I was steadily gaining weight, and it wasn't not like I was eating correctly. I wasn't. Even though I wasn't gaining any weight through the 10-year process, it's not that I was eating always the best. And so like I said, when I did my research and I realized that I was in this menopause phase, and I came to a very harsh conclusion that I had gained 62 pounds of my 175-pound weight loss back. And I remember going back to that mirror scene again, seeing myself again. Once again, I was in front of a mirror, and it was as if I saw that 370-pound person in the mirror. And I had not been 262 pounds in years. So for me, that was overwhelming. And it was depressing, to be honest with you. But I knew that I had to do something about it. Wasn't quite sure which direction to go. I remember my primary care in 2018, doctor offered or suggested that I do keto. And I was trying to do the keto diet or the lifestyle, should I say, the keto lifestyle. and it wasn't working for me only because mentally I was not prepared. I was just not ready. And 2019 is when I found out how much I really weighed, which was the 262. And that's when I decided that I was going to, it was April, I will never forget, it was April of 2019. I decided that I was going to make a change. And I started I started keto, low carb lifestyle. And at first it was a little challenging because, sweets are and sugar is so addictive. You really don't realize how much sugar is in everything. And which I know and I just that was the toughest thing, is to give up the sugar. I can remember saying to my primary care doctor, well, I'm still gonna drink sweet cream in my coffee because I can do everything else, but I just can't give up the sweet cream. Mm-hmm. And the suggestion was, why don't you put half and half in your coffee? And I said, well, I can try that, but I can't guarantee. And I started to do that. And to this day now, I do not put sugar, not even sweeteners, in my coffee. I can drink coffee with just cream. And I think around September, October is when you and I started working together. I think I probably had dropped something like maybe 25, maybe 30 pounds at the time. And then I had an opportunity to work with you, which was absolutely amazing. And one of the things that I will say about you, Dr. Covington, is that you care about the whole person. And for me, it was, and I don't mean to get emotional, but it was really a godsend. Not only did you care about my weight, but you cared about me as a person, what was going on in my life. One of the things that I remember that I cherish is the fact how thorough you were, how you checked everything. And in doing so, that's when we found out that I had a hernia issue. And if you had not been that thorough, I don't know if I would have ever realized when I did that I had a severe hernia problem. I didn't even know how severe it was until the surgery that I had early 2020, June 2020, to get the hernia fixed. And so that's one thing that I absolutely love about you. You care about the whole person. You're thorough. I love the fact that you hold your patients accountable. I'm just overwhelmed and with gratitude towards you, and that you are probably one of the best doctors that I've had. That is just so incredibly thorough. And I think that more people, especially weight loss surgery patients that have regained weight, I know what that's like, that feeling. You feel discouraged, you feel defeated. A lot of us go into hiding. We don't want to deal with people. Some of us have felt like our families had discouraged us initially from doing it. And you get that "I told you so" type of thing. So you go into hiding. And again, like I said, I know what that's like. And I feel as though that's my calling, is to go get my brothers and sisters, my weight loss family, and help them come out of hiding, get back on track, and continue to live a healthy lifestyle. I feel that that's what I'm called, one of my callings to do, because I can share my own personal story, and I've got pictures to share, to show my journey from when I was really large up until I lost the weight, till I regained the weight. So I just think that more weight loss, people need to have a bariatrician in their life. And I really do think surgeons need to recommend that, because they're not necessarily into nutrition, where you are.
Mm-hmm. Mm-hmm.
So,
Yeah. Well, that was excellent. Such a great journey that I think a lot of people are definitely going to connect to. And I agree 100%. The part of being a weight loss doctor or bariatrician or obesity specialist, we go by all of those names. Part of our responsibility is to not only help people to lose weight, but I think people forget that we're also part of the equation when there's weight regain. And especially with our bariatric surgery patients, those patients absolutely feel a lot of guilt and embarrassment, and they struggle quite a bit on their own. And I think some people don't realize that there are options and solutions for them. The bariatrician is the long-term primary care for the bariatric surgery patient. So I'm happy to hear your story, but also the courage that you had to say, you know, I'm not going to continue to allow the weight to defeat me, but I'm going to do something about it. And there's a couple things that really stick out to me in your story. One, some of the weight regain was not necessarily from habits in terms of diet and exercise. And that's one of the largest stigmas, is that when we see people gain weight after surgery, the first thing that everyone says is, you're doing something wrong. You're eating too much. You're not exercising. In your case, your hormones changed. You went through menopause. And we absolutely see weight gain after menopause. We see weight gain in individuals as they age because muscle turns to fat, metabolism starts to make some changes. We see it in men as testosterone goes down. We see it in women after hysterectomy. So we definitely see changes with male-female hormones. And unfortunately, we do see weight gain as a result of that. So I think that that's very poignant to point out, is that weight regain after bariatric surgery is not always because of eating habits. You're honest to say that my eating habits during the time that I maintained my weight loss was not perfect. But that was not the full reason for that, 60-pound weight recidivism, or that's another word basically for weight regain. So that's really, exceptional to point out that some of the weight gain was not all of your fault, right?
Yeah.
The other thing that we see in our bariatric surgery patients is that there are some physiology changes that happen. Part of that stomach has been taken away. If it's gastric bypass, it may be a less amount than the vertical sleeve gastrectomy, where there's, close to 80% of that stomach is taken away. In removing that stomach, we also remove hunger receptors. However, what we know is that after 2 to 2.5 years, those hunger receptors start to revert. So people physically become more hungry because they start to rebuild the hunger receptors back that they lost. So there are some body physiology changes that also, unfortunately, lead to weight regain. What I think is most important to capture from this conversation is that, if you are one of those individuals out there who had bariatric surgery, you lost a lot of weight and you're regaining it, what do we do now? So what advice or tips would you give those individuals who are struggling with weight regain, and they're embarrassed and they're afraid and they don't want to tell their surgeon, they don't want to tell their primary care doctor? What advice would you give them?
What I would say is, and I know that it's difficult, to be able to admit, but, I think people, individuals have to take a long, hard look at themselves and say, and just take the plunge, just like they took the plunge to do the surgery. And, for me, I think that just looking at your lifespan, wanting to live a longer life, you want to add years and not take away years from your life. So I just think that, which I can clearly say and understand is not easy, but just take the plunge and, talk to your doctor, he or she about it, and, try to get some help that way. That would be one of my suggestions.
In the weight that you are re-losing, talk to me about how that feels. How does it feel to see the scale going down? And if you don't mind sharing, how much weight have you lost since regaining?
I've lost, I think it's around 65 pounds. I had not been in the 100s in a long time. So when I saw 197, and I don't mind saying it, when I saw 197, I was so incredibly happy. I could not wait to tell Dr. Covington that I was in the 100s. And I just feel rejuvenated. I feel like I felt when I first had gastric surgery. I just feel, oh, so excited. And let me also add, I forgot to mention that this go round, I incorporated exercise because during this journey, I did in 2016 have a hip replacement, which allowed me mobility. So I started doing boot camp. I could not believe I was doing boot camp, which I thought initially was aerobics, but it ended up being boot camp. And I walked and I did boot camp, and I was really on a mission to be healthy. Right now, the challenge I have before me is one of my mentors signed me up for a half marathon race, which I'm just going to be honest with you. I wasn't so happy about that when they told me. And I thought, oh my goodness, why would you do that without even consulting me first? I have never run in my entire life. So this is going to be something different. I am working up to it. I told them, I said, you know what? It's going to probably be more like a walk than a run, but I may walk, run, more walking than running. So, I guess I have to push myself to do something different. And I'm up for the challenge. Initially I was shocked. I couldn't believe it. I said, not a 5K. We're gonna go all the way to a half marathon already. Can I get a 5K, please?
Yeah.
Yes.
Awesome. That's so awesome. And what's important to point out is, in a weight journey, it is whatever it needs to be at that time that's going to be most effective and best personalized for you. When you started out, it was bariatric surgery. For whatever reason, the hip, pain, reduced mobility, the urgency to lose a significant amount of weight a little bit quicker. And it's wonderful to see weight journeys evolve. Right now, you're doing mostly diet and exercise, and there may be different plans for different people. What are the options for individuals who have regained weight? The options are limitless. It may be, fine tuning nutrition. It may be various different, diets. And I agree with you. With diets, it's really lifestyle. It's not just a set of rules, but it's really what can you consistently do long term that's going to be most beneficial for how you need to eat to be healthy. It may be exercise. It may be FDA approved weight loss medications. That's something that we use in this office. It may be meal replacement. Whatever it is, it's important to work with a professional to see what does it look like for this next part of the journey. But I'm very impressed that you are doing some heavy exercise and boot camps and calisthenics and HIIT and all of that stuff and getting ready for a half marathon, and that you're really doing a lot of intense things with formulating your diet and sticking to that. So that's awesome. As we wrap up, you said a lot about the benefit of, support. You were in the head of the support group, accountability here in my office. What other things would you say for individuals who are currently where you used to be with weight regain, in terms of advice to make sure that they're plugged in and they have a supportive network? What advice would you give them for how to seek that out?
I find that I do better when I have, that kind of support. And one thing I just wanted to kind of interject is, a lot of times people have said, oh, you took the easy way out. I just wanted to say that by getting surgery. And let me just clarify, that is not the easy way out. And it really bothers me when people say that because, people can lose their lives over, and I know some people that have had the surgery and lost their lives, but at the end of the day, when we do take on weight loss surgery, what we have to remember is that we definitely have to have a healthy lifestyle, which I didn't. To be truthfully honest, I was not eating necessarily healthy. And that didn't happen till what, almost 12 years after that I got the clue. Oh my God. And I mean, it's not that I didn't know that. These are things I already knew, and I had to start to incorporate those things in my life. So.
Awesome. Well, thank you so much, Ms. Harper, for meeting with me and discussing this very important topic. And for subscribers and viewers and followers, I hope to see you soon. Take care.